Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is an NCLEX case study. Without the way, let's get started.
Ms. S is a 58-year-old African-American woman who was admitted to the coronary care unit from the emergency department with reports of chest pressure and indigestion associated with nausea. She started feeling ill about 10 hours before she called her daughter, who brought her to the emergency department for admission. She told the nurse that she tried drinking water and took some bismuth subsalicylate that was in her bathroom medicine cabinet. She also tried lying down to rest, but none of these actions helped. She states it just gets worse and worse. Ms. S has been under a healthcare provider's care for the past 12 years for management of hypertension and swelling in her ankles. She was a smoker for 43 years but quit 1 year ago. Her past medical history includes gallbladder disease and gastroesophageal reflux disease. In the emergency department, admission laboratory tests, including levels of cardiac markers, were performed, and a 12-lead electrocardiogram was taken. Ms. S's CCU vital sign values on admission are as follows: blood pressure 174/92, heart rate 120 to 130 beats per minute, irregular, respiratory rate 30 to 34 breaths per minute, temperature 99.8 degrees Fahrenheit. Question 1. Based on Ms. S's admission vital signs, which HCP orders would the nurse expect? Select all that apply. 1. Continuous cardiac monitoring. 2. Blood pressure checks every 10 minutes. 3. Oxygen at 2 liters per nasal cannula. 4. Instruct patient to breathe and rebreathe into a paper bag. 5. Acetaminophen 650 mg, as needed, for temperature greater than 99 degrees Fahrenheit. 6. Check apical heart rate with each set of vital signs. The correct answers are 1. Continuous cardiac monitoring, 3. Oxygen at 2 liters per nasal cannula, and 6. Check apical heart rate with each set of vital signs. Rationale. Because the patient's heart rate is rapid and irregular, she should be on a continuous cardiac monitor, and her apical pulse should be monitored. Her O2 saturation is low normal, and her heart rate is rapid and irregular, so supplemental oxygen will be useful to her heart. Although her blood pressure is high and needs to be monitored, every 10 minutes would not allow for patient rest. Adding oxygen to increase myocardial oxygen levels may help restore Ms. S's respiratory rate to normal. Using a bag is a strategy for a patient who is hyperventilating and is not appropriate in this case. Acetaminophen is usually ordered for a higher temperature. Also, the HCP would likely want to discover the reason for any very elevated temperature so it could be treated. Question 2. Which risk factors from Ms. S's history would suggest a possible cardiac problem to the nurse? Select all that apply. 1. Hypertension for 12 years. 2. Smoked for 43 years, quit smoking 1 year ago. 3. Surgery for gallbladder removal 1 year ago. 4. Ms. S's father died at age 42 from a heart attack. 5. Patient's weight is 278 pounds. 6. Diet includes fast foods 3 to 5 times a week. 7. Patient is an African American female. 8. History of gastroesophageal reflux disease. 9. Report of chest pressure and indigestion associated with nausea. The correct answers are 1. Hypertension for 12 years, 2. Smoked for 43 years, quit smoking 1 year ago, 4. Ms. S's father died at age 42 from a heart attack, 5. Patient's weight is 278 pounds, 6. Diet includes fast foods 3 to 5 times a week, 7. Patient is an African American female, and 9. Report of chest pressure and indigestion associated with nausea. Rationale. Risk factors for cardiac problems include hypertension, family history, obesity, and high-fat diets. African Americans have higher rates of high blood pressure, high cholesterol, obesity, and diabetes, which are major risk factors for heart disease. Symptoms of chest pressure with indigestion and nausea are signs that suggest a heart problem. Gallbladder surgery and gastroesophageal reflux disease would not be risk factors. Quitting smoking would be a risk factor, and the years that the patient smoked would be a strong risk factor. Question 3. Which action is best for the nurse to delegate to a new assistive personnel, orienting to the CCU when caring for Ms. S? 1. Placing the patient on a cardiac telemetry monitor. 2. Drawing blood to test cardiac marker levels and sending it to the laboratory. 3. Obtaining a 12-lead ECG. 4. Checking and recording the patient's intake and output. The correct answer is 4. Checking and recording the patient's intake and output. Rationale. Checking and recording intake and output are within the scope of practice for APs. Initiating telemetry, performing venipuncture, and obtaining ECG require additional education and training, and would not be delegated to a new AP. Attaching ECG leads may be done by APs in some facilities, as may venipuncture and ECG recording. The APs performing these tasks, however, would require additional specialized training. These actions are generally considered to be within the scope of practice of licensed nurses. Question 4. Which action prescribed by the healthcare provider for Ms. S takes first priority at this time? 1. Measure vital signs every 2 hours. 2. Obtain a 12-lead ECG every 6 hours. 3. Place the patient on a cardiac monitor. 4. Check levels of cardiac markers every 6 hours. The correct answer is 3. Place the patient on a cardiac monitor. Rationale. Cardiac monitoring is the highest priority because the patient's heart rate is rapid and irregular, and the patient is experiencing chest pressure. The patient is at risk for life-threatening dysrhythmias, such as frequent premature ventricular contractions. Measuring vital signs every 2 hours, checking levels of cardiac markers, and recording a 12-lead ECG every 6 hours are important to accomplish, but cardiac monitoring takes first precedence at this time.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 5. Ms. S's cardiac telemetry monitor shows a rhythm of sinus tachycardia, with frequent premature ventricular contractions and short runs of ventricular tachycardia. Which drug should the nurse be prepared to administer first? 1. Amiodarone IV push. 2. Nitroglycerin sublingually. 3. Morphine sulfate IV push. 4. Atenolol IV push. The correct answer is 1. Amiodarone IV push. Rationale. With frequent PVC, the patient is at risk for life-threatening dysrhythmias, such as ventricular tachycardia or ventricular fibrillation. The patient is already showing short runs of ventricular tachycardia. Amiodarone is an antidysrhythmic drug used to control ventricular dysrhythmias. Nitroglycerin and morphine can be given for chest pain relief. Atenolol is a beta blocker, which can be used to control heart rate and decrease blood pressure. Question 6. Ms. S tells the nurse that she has worsening chest discomfort. The cardiac monitor shows ST segment elevation, and the nurse notifies the HCP. Which prescribed action takes the highest priority at this time? 1. Administer morphine sulfate 2 mg IV push. 2. Schedule an ECG. 3. Draw blood for coagulation studies. 4. Administer a histamine 2 blocker every 12 hours. The correct answer is 1. Administer morphine sulfate 2 mg IV push. Rationale. Morphine sulfate has been ordered to relieve the chest discomfort that is common when a patient has an acute myocardial infarction. Relief from the chest pain is the highest priority at this time. Histamine 2 blockers are used to prevent gastric ulcers. Scheduling an ECG or drawing blood for coagulation studies, although important, will not help relieve chest discomfort. Question 7. Because Ms. S continues to experience chest discomfort and has elevated levels of cardiac markers, the following interventions have been prescribed by the healthcare provider. Which interventions should the nurse delegate to an experienced AP? Select all that apply. 1. Measuring vital signs every 2 hours. 2. Accurately recording intake and output. 3. Administering tenecteplase IV push. 4. Drawing blood for coagulation studies. 5. Assessing the cardiac monitor every 4 hours. 6. Assisting the patient to the bedside commode. 7. Helping the patient with morning care and partial bed bath. 8. Assessing the patient's pain level. 9. Reminding the patient to report any episodes of chest discomfort. The correct answers are 1. Measuring vital signs every 2 hours, 2. Accurately recording intake and output, 6. Assisting the patient to the bedside commode, and 7. Helping the patient with morning care and partial bed bath. Rationale: measuring vital signs, recording intake and output, and assisting patients with activities of daily living are all within the scope of practice of the AP. Administration of IV drugs, venipuncture for laboratory tests, interpreting ECGs, and assessments are beyond the scope of practice of APs and are applicable to the practice scope of the professional nurse. In some facilities, APs may receive additional training to perform venipuncture, but the nurse would need to assess the AP's ability to safely perform this skill before delegation. Question 8. Patient is scheduled for an emergent cardiac catheterization with possible percutaneous coronary intervention. Ms. S asks the nurse what is involved with this procedure. What is the nurse's best response? 1. It is a procedure that is usually done on patients who have heart attacks to diagnose blockages in the arteries that feed the heart. 2. The cardiologist will use a catheter to inject dye and locate narrowed arteries, then may inflate a balloon to open the artery and place a stent to keep it open. 3. Cardiac catheterization is usually performed on an outpatient basis to determine whether or not you have had a heart attack. 4. After the cardiac catheterization, you will come back to the coronary care unit, where you will be on bed rest for 6 to 8 hours, and we will check your vital signs often. The correct answer is 2. The cardiologist will use a catheter to inject dye and locate narrowed arteries, then may inflate a balloon to open the artery and place a stent to keep it open. Rationale: the nurse's best response should be attentive to and answer the patient's question. For the cardiac catheterization, the patient is taken to a special lab, where the cardiologist uses an invasive catheter with injectable dye to locate and diagnose narrowed sections of coronary arteries. For percutaneous coronary intervention, a catheter is placed with a balloon, which can be inflated to open the narrowed section, and a stent can be left in place to keep the artery opened.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 9. Ms. S has returned to the CCU after a cardiac catheterization and a percutaneous coronary intervention procedure. The nurse knows which of the following is within the scope of practice of the LPN/LVN. 1. Reminding the patient to remain on bed rest, with the insertion site extremity straight. 2. Preparing a teaching plan that includes activity restrictions and risk factor modification. 3. Measuring the patient's vital signs every 15 minutes for the first hour. 4. Assessing the catheter insertion site for bleeding or hematoma formation. 5. Monitoring peripheral pulses, skin temperature, and skin color with each measurement of vital signs. 6. Administering 2 tablets of acetaminophen for back pain. The correct answers are 1. Reminding the patient to remain on bed rest, with the insertion site extremity straight. 3. Measuring the patient's vital signs every 15 minutes for the first hour. 4. Assessing the catheter insertion site for bleeding or hematoma formation. 5. Monitoring peripheral pulses, skin temperature, and skin color with each measurement of vital signs. And 6. Administering 2 tablets of acetaminophen for back pain. Rationale: all of these interventions are within the scope of practice of an experienced LPN/LVN. The LPN/LVN would be instructed when to notify the RN or the HCP of any abnormal findings. Preparing a teaching plan requires additional education and is more suited to the RN's scope of practice. Taking vital signs and reminding the patient about bed rest could also be delegated to the AP. Question 10. Which information is most important to prevent recurrence of reocclusion of the coronary artery, chest discomfort, or myocardial infarction? 1. Remain on bed rest for the next 24 hours. 2. Patient will be prescribed dual antiplatelet therapy. 3. Patient should do no heavy lifting for 48 hours. 4. HCP will prescribe a beta blocker. The correct answer is 2. Patient will be prescribed dual antiplatelet therapy. Rationale. Without stent placement, the artery often reoccludes because of the artery's normal elasticity and memory. Patients who undergo percutaneous coronary intervention are required to take DAT consisting of aspirin and a platelet inhibitor to prevent recurrence of artery blockage, chest pain, and myocardial infarction. Patients are not kept on bed rest for 24 hours, rather, they are instructed to do no heavy lifting for several days after this procedure, and they are often prescribed a beta blocker to slow heart rate and lower blood pressure. Question 11. Ms. S's daughter asks the nurse why her mother did not receive a clotbuster drug. What is the nurse's best response? 1. Thrombolytic agents, also called clot busters, are most effective when administered within the first 6 hours of a coronary event. 2. Thrombolytic drugs are much more effective when used for patients who have had a recent stroke. 3. Thrombolytic drugs work better for patients who have a heart attack at a much younger age. 4. Contraindications for these drugs include recent surgeries, and your mother had gallbladder surgery a year ago. The correct answer is 1. Thrombolytic agents, also called clot busters, are most effective when administered within the first 6 hours of a coronary event. Rationale. Thrombolytic therapy using fibrinolytics dissolves thrombi in the coronary arteries and restores myocardial blood flow. Intracoronary fibrinolytics may be delivered during cardiac catheterization. Thrombolytic agents are most effective when administered within the first 6 hours of a coronary event. They are used in men and women, young and old. Question 12. Ms. S's condition is stable, and she has been transferred to the cardiac step-down unit. What should the step-down nurse instruct the AP to report immediately? 1. Temperature of 99 degrees Fahrenheit with morning vital sign monitoring. 2. Chest pain episode occurring during morning care. 3. Systolic blood pressure increases of 8 after morning care. 4. Heart rate increases of 10 beats per minute after ambulation. The correct answer is 2. Chest pain episode occurring during morning care. Rationale. Chest pain can be an indicator of additional myocardial muscle damage. Additional episodes of chest pain significantly affect the patient's plan of care. Small increases in heart rate and blood pressure after activity are to be expected. The patient's temperature, only 0.2 degrees Fahrenheit higher than at admission, is not a priority at this time, but it will need continued monitoring.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 13. The HCP prescribes captopril 12.5 mg orally twice daily, and hydrochlorothiazide 25 mg orally daily. Which information would the nurse be sure to include when teaching Ms. S about these drugs? 1. Take your hydrochlorothiazide in the morning. 2. If you miss a dose of captopril, take 2 tablets next time. 3. Avoid foods that are rich in potassium, such as bananas and oranges. 4. You should expect an increase in blood pressure with these drugs. The correct answer is 1. Take your hydrochlorothiazide in the morning. Rationale. Hydrochlorothiazide is a thiazide diuretic used to correct edema and lower blood pressure, and it should be taken in the morning, so that its diuretic effects do not keep the patient up during the night. A side effect of hydrochlorothiazide is loss of potassium, and patients may require potassium supplementation. Captopril is an angiotensin-converting enzyme inhibitor that lowers blood pressure. It is never appropriate to take twice the dose of this drug. Question 14. The HCP orders dual antiplatelet therapy for Ms. S. What is the nurse's highest priority concern for this patient? 1. Reminding the patient to do no heavy lifting while hospitalized. 2. Assessing the progression of walking in the halls. 3. Teaching the patient to apply oxygen for any shortness of breath. 4. Monitoring the patient for any form of bleeding. The correct answer is 4. Monitoring the patient for any form of bleeding. Rationale. Dual antiplatelet therapy is suggested for all patients with acute coronary syndrome, incorporating aspirin and either clopidogrel or ticagrelor. The major side effect for each of these agents is bleeding. Observe for bleeding tendencies, such as nosebleeds or blood in the stool. Medications will need to be discontinued if evidence of bleeding occurs. Question 15. The HCP prescribes atenolol 50 mg each morning for Ms. S. Which of the following relates to this drug? 1. Hold the drug if the patient's blood pressure is higher than 100/80. 2. Give the drug if the patient's respiratory rate is greater than 30 breaths per minute. 3. Hold the drug if the patient's heart rate is less than 60 beats per minute. 4. Give the drug if the patient's blood pressure is less than 90/50. The correct answer is 3. Hold the drug if the patient's heart rate is less than 60 beats per minute. Rationale. Atenolol is a beta-blocker drug. Do not give beta-blockers if the pulse rate is below 60, or the systolic blood pressure is below 100 mm of mercury, without first checking with the HCP. The beta-blocking agent may lead to persistent bradycardia, or further reduction of systolic blood pressure, leading to poor peripheral and coronary perfusion. Question 16. Which activities could the nurse delegate to the AP, assisting Ms. S during Phase 1 of cardiac rehabilitation? Select all that apply. 1. Assist with Ms. S's morning bath as needed. 2. Refer Ms. S to a monitored cardiac rehab program. 3. Ambulate with Ms. S to the bathroom. 4. Administer Ms. S's morning doses of captopril and hydrochlorothiazide. 5. Assist with progressive ambulation in the hall. 6. Assess Ms. S for additional chest pain or pressure. The correct answers are 1. Assist with Ms. S's morning bath as needed, 3. Ambulate with Ms. S to the bathroom, and 5. Assist with progressive ambulation in the hall. Rationale. Cardiac rehabilitation is the process of actively assisting the patient with cardiac disease in achieving and maintaining a vital and productive life, while remaining within the limits of the heart's ability to respond to increases in activity and stress. It can be divided into 3 phases. Phase 1 begins with the acute illness and ends with discharge from the hospital. Activities during this phase that could be delegated to an AP include assisting with morning care such as a bath, assisting a patient to the bathroom, and assisting with progressive ambulation in the hall. The nurse would be sure to instruct the AP to stop any activity that caused chest pain or pressure and report this at once. Referrals, administering drugs, and assessing patients require additional educational preparation and are suitable for professional nurses.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
Question 17. Before discharging Ms. S, the HCP orders an electrocardiogram. This test reveals normal sinus rhythm with a heart rate of 87 beats per minute. What is the nurse's best action at this time? 1. Delay the patient's discharge until she is seen by the HCP. 2. Administer the patient's next dose of atenolol 3 hours early before she goes home. 3. Contact the HCP and ask about drawing an additional set of cardiac markers. 4. Document this finding as the only action and prepare for discharge. The correct answer is 4. Document this finding as the only action and prepare for discharge. Rationale. Normal sinus rhythm with a rate of 87 beats per minute is a normal finding. There is no need to delay the patient's discharge, give early medications, or draw additional cardiac markers. The nurse would document this as a normal finding and prepare the patient for discharge.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.